topic is really interesting for cardiothoracic surgeons. The optimal operation for complex aortic disease is not known yet. So there are a couple of options, like two-stage elephant trunk procedure, which is associated with like 36% mortality. And other procedures like type 1 hybrid have some risk factors like migration of the graft, like retrograde aortic type 1 aortic dissection. And also there's like frozen elephant trunk procedure, which is also associated with like 15% mortality and 8% spinal cord ischemia. So type 2 hybrid approach is one of the approaches that decrease some complications like type 1A endoleak, like a neurological problem, and also the retrograde type A aortic dissection. So it's not well known the outcomes. We decided to work on that and study all results, all patients, to see what's the outcome. It was some part of the results were expecting, like the mortality rate and like neurological diseases after the surgery. But the interesting part was that we divided our patients to both acute aortic dissection and patients with chronic aortic aneurysm. So we found that this procedure can be done in both group of patients, acute and also chronic. Another important thing was that we found some associations with in-hospital mortality, and 7 out of 8 patients who died were older than 65 years old. So we would recommend the patient, the doctors, surgeons, to be more careful about these patients. And we think that this procedure decreased the mortality from 36% to less than 20%. And the interesting part was that no patient died in emergent group after 30 days of the discharge. 4 patients died in elective group, and only 1 of them were related to surgery, and others had like infection, like couple of months after surgery, a stroke couple of months after surgery, and also 1 had cancer. So only 1 patient in midterm follow-up died due to surgery. I think the experience about this procedure is pretty limited. We need more studies. Probably it's better to have like prospective multi-institutional study and compare this two-stage hybrid tool with other hybrid and non-hybrid procedures to find the best option for treatment for these patients. Since this procedure is really complex and these patients have like huge problem in their aorta, so there's not many patients or many experience with this procedure. We would like prospective, multi-institutional, and controlled, case-controlled study. It will give us the best answer. I think that it's really good to design a prospective multi-institutional study to compare results and have a control group for that, to make sure that we have adjusted patients' preoperative factors that can have effect in patients' mortality. So this is really good to design this study as prospective, multi-institutional, and case control. I think we will be able to find a good result.